Hello, I am Dr. Padma Sundaram, Consultant Pulmonologist, Fortis Hospital, Cunningham Road, Bangalore. So, as we all are aware, snoring and obstructive sleep apnea is a very common prevalent condition among the general public. However, people do not get diagnosed much early and they suffer from this condition for a long time. Most of the time, the patient himself or herself does not know that they have this problem and they come to us with symptoms of excessive daytime sleepiness, tiredness, fatigability, a raised blood pressure, and we also see a high incidence of diabetes in these people. As we are all aware, this condition is more common in people who are obese or who have a higher neck and waist circumference. The diagnosis of this condition is done by polysomnography. Now, most important is that there are various treatment modalities available for the treatment of this condition. After you get a hospital polysomnography or an in-house polysomnography, we classify your condition as mild, moderate or severe. The most important part of the treatment is, first we need to have a weight loss regimen. So, a combination of diet and exercise can help you to minimize this condition. We need to avoid alcohol and sedatives which can worsen sleep apnea. What is the ideal treatment is called as nasal continuous positive airway pressure, which can be in the automatic mode or a variable automatic positive airway pressure. What does this machine do? It acts as a pneumatic splint. It prevents your upper airway collapse. By doing this, snoring comes down, choking comes down, you have a much refreshing sleep, so the sleep apnea gets abolished. We need to use it at least for minimum 4 to 6 hours every night to see the effect. There are various types of devices which are available in the market which are portable and very handy. You need to use this machine almost every night to have a good result. In case you have a very mild sleep apnea and you are averse to using the CPAP, there are various surgical modalities available in the form of either using a laser assisted plasty, turbinoplasty, or you can have maxillomandibular advancement surgeries. In some people, a triple UP called as uvulopalato-pharyngeoplasty done by the ENT surgeons may be helpful. However, we need to be very careful in which group of people we subject them to surgery. So, it is very important that we diagnose sleep apnea, because if we do not treat this condition, the incidence of hypertension, diabetes, metabolic syndrome, incidence of stroke, cardiovascular complications, early onset of dementia, irritability and also hyperactivity can occur in children. So, diagnosis and treatment can go a long way in managing this condition, which is very common in our society. Thank you.